Hello, my name's Stephen Grinnell from Energy Medicine, and this is a short presentation on knee replacements and how my program knee replacement rehabilitation can help you. I've been working with people with joint problems for probably the last 12 years. I've had a personal journey where I've had 2 hip replacements, so I am sensitive to joint replacements, and I have a treatment place in Stratford where I see probably 3 or 4 people a week with knee replacement issues. Now, they tend to fall into 2 categories, and you'll probably find this is the same for yourself. The first category is somebody that's just had knee replacement. They've had an initial elements of physiotherapy and they want to progress and do more. Or I see somebody that's had knee replacement for a significant period of time, maybe 6 months, 12 months, maybe even longer, and they're not getting the full benefits from their knee. So this is really explaining why that's the case and how I can help you. As I said, I've helped lots of people over quite a long period of time. So the key thing is that you probably had a knee replacement because you had arthritic damage. Tends to be the sort of common sort of element, and you'll have damaged your cartilage down here and it's gone through, so it's thin, so everything's dropped. These here are sort of ligaments and stuff that go through, and you've had a nice shiny new knee put in where they've put metal at the top, metal at the bottom. Sometimes there's a plastic spacer which is known as a button, sometimes not. It sort of depends on the type of surgery you've needed. Now, the problem with knee replacement is bending and straightening. That tends to be obviously the key issue, and that's the main movement for the joint. And it's also very structurally supportive, so it obviously has a very big impact. If we just have a little move on. So one of the people that I've worked with recently is a lovely man called Edmund. Edmund's had 2 knee replacements, so I've seen him post-surgery over the last 3 years. He's had his first one done 3 years ago and his second one done Easter time. So both times we worked quite extensively together, and we worked very much on straight from having surgery, and it was supplementary to his initial physio that he had, and then we progressed on where we got him back walking extended distances. He can now jog, he's sitting, standing, doing all the movements that he wanted to do and more. And I think particularly because he'd had 1 knee replacement, having the second one was really important to get that strong so that he could go obviously into his older age and be sort of fully utilising everything and be very active. So why are knee replacements so problematic? Well, if you have a quick little look at the diagram, you can see there's a lot going on. The key thing to sort of focus on is looking very much at different ligaments. So we've got ligaments either side here, we've got ligaments here and ligaments here. So all of this is very, very structural. And you've got a ligament that comes front to back, one that goes from the back to the front, and then 2 on the side, along with all obviously the tendons and all this sort of other elements that make up your knee. So there's a lot going on in that sort of area. When they do surgery, obviously you have to move these sort of things around to allow obviously the joint to fit in place. They obviously need to move the patella, and they need to actually physically sort of shave down some of the bones so that they can get the various elements to fit and obviously lock in properly so that they're all in the right place. Sometimes that can be more problematic and that causes issues post-surgery, but most of the time, 99% of the time, surgery is usually successful. So why are knees so important? Well, the challenge is how much pressure you put on them. So using a bike or walking, you're looking at around half your body weight. When you walk upstairs, you're looking at around 3 times your body weight. Downstairs, you're looking at 5 times your body weight. Jogging 7 times. But interestingly, squatting, which is essentially a sit to stand from a chair, you're looking at 7 times your body weight. So there's a lot of force going through your knees with just simple everyday activities, and people forget that. So one of the key things that people struggle with is stairs, so going upstairs and coming downstairs. Obviously people are frightened about coming downstairs because you don't want to fall. People very rarely fall upstairs. But the other challenge also is is when you're coming downstairs, it's obviously 5 times your body weight going through each knee as a load. So obviously that's a lot of pressure to put on the joint, and if it doesn't bend or straighten properly, it can make you very unstable and it is very uncomfortable. So the next thing to consider is people struggle very much with kneeling down, and lots of people tell me they can't kneel because of having a knee replacement. It's not that you can't, it's more the case that your knee won't bend enough to allow it. So the key thing to focus on is that here it's shown as your foot's dead straight, which isn't normally the case. It's not quite as high as this, but this is quite a complex diagram showing you all the different forces that are impacting on your knee when you kneel down. And there's a few key things around here which make it more or less comfortable. But the key thing to look at is how close the two legs or the leg is together. So how much of a bend there is to allow that to happen. Because obviously your body is in this position as it comes up. Now, most people talk about bending to 90 degrees. Well, if you think that you were 90 degrees in this position, your leg here would be up this direction, which means you'd fall forward, so you wouldn't be able to do it. So obviously then within that, people don't kneel down, but not being able to kneel down poses lots of other problems with mobility, which you don't always think about. So the other thing with having surgery is that obviously if you've got a joint and it's been repaired and it's had lots of bits taken out, and they tend to do a scar down the front. Now these are bursas. Now bursas are little shock pads basically, so they're like little airbags to help protect your joint. And you can get things like bursitis where they get infected and they get inflamed and you have lumps coming out of different parts of your knee. But most of the time they do act as just a normal shock absorber. Obviously if they're going to have to do surgery and they cut down all through this, all of these bursas disappear. So actually kneeling on your knees feels quite uncomfortable because you haven't got this level of shock absorption. Now these do repair, so there is elements of repair, but they never repair fully, so it is always a bit more uncomfortable. The other thing also is that your knee isn't your knee. I know that sounds obvious because it's metal, or in some cases some sort of carbon fibre, but within that the feedback that you get from that is very strange, linked into the fact that obviously bending is quite challenging. So if we look at the 4 different areas, this is the link to the diagram I showed you initially with a full bend. Okay, so people with knee replacement obviously are going to really struggle with this because it puts a lot of pressure on the knee joint. This sort of position is much more attainable, so people can obviously squat down and get into this sort of position, but it puts lots of loading on individual knees. It also puts quite a lot of pressure on your hips, but as a standard position, this is a sort of position that people tend to use, particularly if you're getting up or down. Obviously, we talked about kneeling up, and you can see that obviously your feet are going to be a factor. But also I talk a lot about 120 degrees, and you can see that obviously for your leg to come up, you're looking at around 120 degrees, significantly not 90, because that would mean that your body's in this position, and as I've already said, you'd fall over. Now, this squatting position's interesting because obviously it puts a lot of load on your body. We know from squatting it's roughly 7 times your body weight, but this essentially is you sitting on a chair. So what you do to make your knees more comfortable is you bring them forwards, and then what happens is you pull your feet backwards so that you can stand up, and to help what you tend to do is lean your body weight forwards. So that alters your body weight position so that you can use momentum of leaning forwards to help stand yourself up. Now, the problem with having any sort of knee pain and then knee surgery is that it massively alters what happens with your pelvis, so how your hips work, how your knees work from a bend point of view, importantly also how your ankles work, and that alters all of the forces as you move along. Now what you tend to find is if you had a knee replacement, you take shorter strides. You also don't tend to use your ankles as much, and you use your hips too much. And when I say you use your hips too much, you tend to walk from your hips. So that puts a lot more pressure on there, and you get things like tilt and rotation and other bits. You also then get a rocking with your hips, so that can put a lot of pressure on your lower back, but also on the individual joints, depending on whether you've had one knee done or both. Now, part of the reason for that is you can't always straighten your legs properly, and when you walk, you don't always land on your heel properly. The other thing is that you're not pushing off your foot properly, linked to your ankle, which then puts less pressure on your knee, but it means you rely on momentum. So all of these things have a big impact on walking. And obviously, if you're struggling walking, that's just basic moving around. Also, the other thing is that you tend to find that your knees are put in square, so they're nice and straight, which is also different to how your feet might be set. You might have your feet slightly turned out, slightly turned in, or one foot turned out, one foot is in. So you've got differences, and those differences have quite a big impact on how it feels when you move, because everybody starts walking in the way that they did pre-surgery, and obviously they've had a lot of changes. In some cases their legs have been altered, so they might be a centimetre slightly longer now, which helps your lower back and your pelvis, but it feels really weird to walk. And as I said, if everything's put square and your lower legs, so your sort of calf area and your foot, are used to being tilted out, that'll feel really strange. So what do I do? How do I help? Well, I've got a clinic based in Stratford. I've been here for 11 years and I help people on a daily basis. So I do lots of work with knee replacement. What I have done is pull together all of my knowledge into an online program that you can access. This online program covers sort of 4 key areas really. You're looking at walking and stairs, bending and straightening. So it's simple stuff, but these core movements support every other movement that you do with your knee. So it is a really important program to do. Now the program itself is split up over 4 modules. The exercises are slightly different, so they're progressive, so each exercise gets more difficult, and the idea is it's to get you to use your knee most effectively. Now, with any type of rehabilitation, the key thing to do is practice, because the more that you practice, the better you'll become, but also it becomes more of a habit. So what you'll have found is you will have had 2 or 3 years of modifying how you move or walk so that you can compensate for the pain that you're in, and ultimately you will have done less movement. Now, successful recovery from knee replacement requires you to work quite hard. So you're looking at wanting to make changes in around 6 weeks. Now, if you're on crutches and you get yourself off crutches, that's normally a 6-week cycle, but your body's still quite weak at that point, and that's when most people stop doing rehabilitation. The idea of this program is it's to take you from that stage, or where you've been stagnated and you've not progressed as much as you want, to go to the next level, so that you can do everything that you could do pre-surgery and more. So it's not just pre-surgery, it's pre-having that knee problem. So it's been able to walk for longer distances, go up and down the stairs repeatedly, kneel down, squat down, pick things up from the floor, take larger strides, and not have any pain either standing or sitting, and also don't have any balance issues. So a lot of the things are relatively simple, but they're all basic movements that make a massive difference to your life, and they're all put in a structured way. There's also a lot of information on things like habits, how you set goals, how you assess where you are, because a lot of people have got so used to compensating and having help that they've lost some of their independence. So it's actually also challenging you to look at the level you're at currently so that you can look to improve. So if you want to find out more information about this knee replacement rehabilitation program, if you have a little look at energymedicine.io and it's knee replacement rehabilitation, there's an opportunity to buy the course. It's only £27, so it's a very small financial commitment, and it's all online, so you can log in. It's all videos. They're all nice and easy to use. It's me talking, so we're showing you lots and lots of different movements, and there's some other elements and some bonuses that link into habits, assessment, walking tests. So there's a lot of information there that would really benefit you. So check out energymedicine.io knee replacement rehabilitation now.